Jessica, you might have to click out from your other device that you're trying to get in from and click back in.
I did that. Okay, I'll try. Okay. Can't.
Thank you, Tricia, for again helping us out. Thank you.
Not a problem. I'm always happy to help.
I appreciate it. It's endless. I'm ready whenever. Is Dr.
Yeah, I think-
Lantigua, is he here?
I am.
Oh, thank you, sir. Okay,
Hello.
why don't we start? So are we ready to start, Jessica?
Yes, ready.
Okay. So thank you everyone for again joining us. Maria's everywhere. You're frightening, Maria Lizardo. I'm Gail Brewer, Manhattan Borough President, and I want to thank everyone for joining us once again on our 3 o'clock on Tuesday. I think you know we talk about health and we talked about recovery, and we're going to focus today on COVID. I never know where we are with this pandemic. I will tell you that for somebody who's in the community and out at so many meetings, I do get quite a few calls saying there was COVID here today. You have to get tested again. It happens to me a lot. I go get tested and I'm okay, but it's pretty constant. So I appreciate all the work that's being done, certainly by the health profession. And I'll say great things about Dr. Antigua in a minute, but the test and trace. I have to say also, just getting a test right now is challenging. Maybe it's not for others, but I've had troubles. The other thing is for people like me, and I'm somewhat unique. When you go on a stage, understandably, today you have to be vaccinated, which I am, but you also have to get a test to be sure that it's a real vaccination and that you're healthy. So that's not so easy in my experience, because you have to do it quickly. So I think that might be part of the discussion, but I am a huge fan, as we all are, of Dr. Rafael Lantigua of Columbia University. When he walks into a room in Washington Heights, it's like a standing ovation. And also just in terms of his personality being so accessible and trusted by the community. And you, Dr. Lantigua, have been providing so much over the years, quality healthcare at Columbia University in Washington Heights, but also this vaccine and what it has or has not provided to the community and what the challenges are. So we're dying to hear from you. I think we want to know what some of the testing percentages are, a little bit about hospitalization, maybe what the great things that Columbia is doing, Presbyterian, I should say, and what are some other current aspects of what we should be looking at. It does seem to me that this pandemic changes all the time. We never know what's next. Obviously, we are concerned about the schools now. We hope it goes well. I was at PS 79 this morning. That's a school in East Harlem that closed. It's now open. This is a school with very dedicated teachers and principal. The kids have special needs, and they were very happy to be back in school, but it's really hard on the staff. So thank you very much, sir. Thank you, Dr. Lantigua, for being here. You're like our hero. Thank you. The floor is yours, sir.
Thank you, well, President. It's an honor to be with you again. I mean, as you know, nobody is more respected than you in Manhattan.
I think you, sir.
You are really people elected official. And I always said we want to see girl in a place, just call her. She will come. We all get surprised how hard you work on behalf of us. We really appreciate your work. Let me tell you, we have an echo.
Something's, yeah. I'm gonna get off me.
Okay. Let's see now. Like I said, I mean, we're still in this pandemic, and we know that. I mean, a little bit concerned about the fall and the winter. We are really lucky because, I mean, the cases are slightly coming down in this city. in spite of the school being open last week, we are seeing a decrease in cases of 6%. I mean, and that's good news to that sense. However, we're always concerned that, again, that because we're going more and more indoor, that we may get really, more sick. And I think that the effort are twice now. The effort continue to be mitigations. And mitigation is that wear the mask. And now we're asking also the children to wear the mask while they're in school and the teachers. Two, the second is that let's keep pushing to get people vaccinated. Let's be sure that we get the first vaccine in people armed. We're still well below what we'd like to be. As of today, we are around, 72% in Manhattan, which is the biggest at Borough, 70% in Queens, 56% in Bronx and Brooklyn, and 59% in Staten Island. That we are well below the 75, 80% that we're looking for. And we're doing very well in the Northeast. It's a mandate now for the teachers, and that's been fought in court, and then for healthcare workers to be vaccinated. And no doubt that the mandate increased vaccination rate. And we see that here at NYP. NYP, New York Presbyterian, 97% of us are vaccinated because a mandate for us to get vaccinated. At Columbia, 99.1% of us are vaccinated. 99.1%, that's a good number, excellent number. That we feel safe to be among ourselves in the institution because practically all of us have the vaccines. That the emphasis continues to be, let's give the first shot, and the second one into people armed. And second now is the booster, no? And let's give it to those who are eligible and who know who they are. Before, it was those who are immunosuppressed. People who had cancer, people who have taken prednisone, people that we knew that had lupus, people that we knew that they didn't have the immunity that we expect to be normal. Now, we know because of the data that people over 65 years old should be vaccinated. We also know that people between the age of 50 and 64 who have a high risk condition, and this is defined as having diabetes or hypertension or cancer or obesity or asthma or emphysema, those ones should be vaccinated. And that's a very large number in the group. And that will be more than 60% of people who are over 50 years old. And then from those who are 40 to 50 years old, it should be for those who have chronic conditions that we feel that put them at high risk. The other group that also we feel that you get a booster are, of course, healthcare workers, workers in nursing homes, and also teachers and those students over 12 years old. Again, this so far is only for Pfizer vaccines, and we are not crossing one vaccine to the other. If you have Moderna, we're still waiting to see the Moderna data to tell people if they should be vaccinated. It's expected by next week. Moderna is going to present the data and we'll know more. Again, and vaccination is recommended 6 months after the second dose. That would be, there's a group of people who go Pfizer in February and in March that now they're ready to get a booster. And like I said, Moderna data should be coming next week, and soon after, we should be hearing from Johnson & Johnson. In the case of Johnson & Johnson, will be a second vaccine. But this is what we are now. I want to remind people again that the vaccines were developed to prevent 3 things. Hospitalization, that's 1. ICU, intubation, that was 2. And 3, death. And the vaccines are not really 100% effective. We know that Moderna and Pfizer, 94 to 95% effective, meaning there are 4 to 5% of people that are not going to develop antibodies. And this is in paper. We know that really, in the practice, they behave better than those. How do we know? Because breakthrough infections, because those who get into the hospital. We do get people who are vaccinated into the hospital, but those are less than 2% of those who are in the hospital, and less than 1% of those who are in intensive care unit. We do see people who are vaccinated that because of one reason or the other, when we do random test, they become positive, and for PCR, but when they become positive, most of the time they have no symptoms or they have very little symptoms. And that we're willing to live, really, these days, with persons that could develop like a core symptoms, a little bit of malaise, a little bit of cough, everybody knows because they got a breakthrough case of COVID after they were vaccinated. The other challenge these days, as you know, is that we start also doing influenza vaccine. In that we started about a month ago to get influenza vaccine. The good news about this is that both vaccines could be given together. That you can get COVID in one arm and you can get influenza in the other arm, and there are no cross reaction. I mean, and this is a recommendation. If you have the opportunity to give a patient both of them, you will give both of them at the same time. In terms of booster, it's a CDC publication from yesterday that is telling us that the reaction to the third vaccines is equal to the reaction to the second vaccines. And that again, people, some small amount of person are going to get malaise, a little bit of fever, headaches, a cough that will go away usually between 24 to 48 hours. And that we are in safe ground. But again, the emphasis has to continue to be to get people vaccinated. And we know that the rate of vaccination changed from neighborhood to neighborhood. And I can give you an example of this data from the city. If you go into a health kitchen, 99% of people are vaccinated. If you go to Inwood or to Washington Heights, only 63% of those are vaccinated. I mean, and the irony, it was there was very few COVID downtown last year. There was a lot of COVID uptown because we knew that it was mainly last year the disease of minorities and the elderly. And out of 12 persons in Inwood are positive for COVID. Out of 1 or 3 in downtown are positive for COVID. The rate is very small downtown, but very high up here. However, the rate of vaccination is much better downtown, where we didn't see COVID that is up here. And again, I said, the emphasis should be the vaccine is effective, it's safe. I mean, we don't see so far, and this vaccine is being used now for 1.5 years. If we take into considerations those that went to the clinical trials that started last June across the country, I mean, we know that we're not seeing major side effect of the vaccines. Are there side effects? Yes. I mean, are they minimum? Yes. Are they less than 1%? Yes. I mean that I know that I'm preaching to the choir, and what I would like to hear is that any question that you may have. I have had 15 more minutes, and I know that you hear a lot about COVID, but a lot of times we don't answer the question because we keep preaching. And what I would like to see what's in your mind and to know if I can answer your questions.
First of all, thank you so much, Dr. Antigua, because that was such a clear question. I think such a clear description. I don't know. I have a question, which is, I have 2 or 3 friends, some of whom were in the newspapers, who got COVID recently, and they all ran and got, I don't know what to call it, the antibody. So can you describe whether that's worth getting or not? It was obviously, first time we heard about it was from number 45, whose name we do not mention as president. So can you talk a little bit about whether that makes sense? These are all breakthrough cases, some of which were in the newspapers, and they ran and got the antibody. And does that help? These were people who I assume would not have much more than, as you described, cough, runny nose, and so on, because they were all vaccinated.
It's all help. I mean, and this is one of the treatment that we have available now. However, most of the time, this medication that's given in the emergency department usually due to avoid hospitalizations. I mean that when you see a person that come in, like you said, with symptoms, and the oxygen is low, and that person doesn't have to come to the hospital, by giving the antibodies, we can avoid 9 out of 10 to go home. In the 9 or 10 after getting antibodies from the emergency department will go home. These are people that used to be inside the hospital before. In the antibodies work, they work against the variant. I mean, it's two types that we have out there. We know they work against the variant. I mean, 99% of the cases that we're seeing in New York City, in the hospital, are Delta. 1%, I mean, is at what we call at beta. But 99% of those are Delta. The original COVID that was here a year and a half ago is no longer present. The virus has suffered mutations, and this is our concern because we are lucky. So far, the vaccines that are available are working against the mutations. Not as good as they work against the original virus. Remember, I told you 94, 95%? Well, it's around 85, 80% for Delta, but it's still very good. Any vaccine that is over 60% is considered very good. Influenza vaccine only protect us around 60%. And this vaccine is still very good, but it's always a concern that we could get the mutations out there where we, those who are vaccinated, are not going to be protected. And that's what we said, mitigation is important. And when we're in front of people who are not vaccinated, I mean, we should wear masks. And if we could avoid them, I mean, put them to one side, and I feel that's going to happen the same way that happened with smokers. Soon we're going to have rooms where people who are not vaccinated, they will go into the room, and people who are vaccinated, they will go into their room. It will be more at the freedom for those who are vaccinated. It's going to happen all over. I mean, we can see that at some point, society is going to say, I mean, no, we really don't feel that you should be in the same room with us. Like smoking, we feel that's a responsibility. People have said to me, why we ask people to wear a seatbelt? It's not because you can be killed, because you can kill others, no? It's the same with the vaccine. When the person who are not vaccinated, it's not because, I mean, you could die from COVID, and we see that all the times, but it's because you can also make other people sick. And I tell you, I mean, you may know him. We lost Dr. Teodoro Gegus yesterday from COVID. I mean, very nice, I mean, hardworking dentist in Inwood. I mean, very hardworking. He died yesterday, unvaccinated from COVID. I mean, here it is. I mean, this is a health professional. And we're sure that because of the profession that he practiced, being a dentist, you have to see the low mouth. And a lot of people were breathing into him. I mean, again, we see that all the time, people that we love are dying from this disease.
Yeah. The new member of the state Senate, Cordell Clare, her son died, 28 years old. He had not gotten vaccinated. So you see, we were just at the funeral.
Yeah.
I know Steve Simon, Community Board 12, had a question. Steve?
Yeah, thank you, Gail. And for those of you who may know me in some other capacity, I'm on this call as the chair of the Community Board 12 Health and Environment Committee. Rafi, you referred to the fact that I think Manhattan and the city as a whole are doing pretty well in terms of their vaccination rates. But you know that our 4 zip codes in Washington Heights and Inwood are not doing that well. We're running 2 to 6% behind the rest of the city and 11 to 15% behind the rest of Manhattan. And I'm very concerned now about the fact that we don't have a real vaccination site in Washington Heights and Inwood anymore, since the Armory closed down and the other site at Yeshiva University has also been closed. And now with the CDC saying that even more people should get the 3rd shot or the booster shot, a lot more people, especially people perhaps who previously got vaccinated at the Armory, are now going to want to know where do they go to get the 3rd shot. So, Rafi, don't you think maybe the hospital should reopen the Fort Washington Armory site? That we're going to need something on that scale to to bring up the vaccination rates in Washington Heights and Inwood, and now to serve all of the additional categories of people that the CDC says should get the third shot?
Yeah, I agree with you. Remember, we still have at open the gardening at the Children's Hospital. Now where we're doing the vaccinations there. I mean, we still have not seen the higher rate like we saw at the Armory. We also have the Black Building. But I agree with you that we soon have to, if the vaccines are not put in the hands of the primary care physicians, but they are not yet. I mean, we keep waiting to hear when the vaccine is going to be in the doctor office. Well, they belongs now, because in terms of Pfizer, it's not an emergency vaccine any longer. It's a regular product since a month ago, no? That this product should be available to physicians where they can pick up, and to pharmacies where people can go and get it. I mean, again, we had to learn how to store the vaccines because of the minus 80 degree. But I mean, it could be distributed at daily or every 2 days by the city. I think that we have to keep pressing more and more to get more of the van from the city in the neighborhood, especially in this type of neighborhood, that we are not getting them. And from time to time, we get one, but when they come to the neighborhood, we don't know that they are here. They should be advertised, like a Union Community Board 12 or Community Board 9, or whatever community board should be told in advance where these are going to be, that you could alert the neighborhood and let them know there's going to be a van available in X area or in a park or at a fair. We have to do that. But there are 31 at a van out there, and neighborhood like ours should have a person all the time, at a van all the time circulating in our area. And again, both need to be done with a lot of education, a lot of testing, especially to the younger, no? But those are the ones, I mean, the 20, 25, 30 years old, and they feel if I get sick, nothing's going to happen to me. And we say, no, that's not true. You can get sick. I mean, people at that age, they don't die. I mean, you don't see a 28 years old dying, usually. I mean, a car accident, we don't see, but the most death last year on people between the age of 20 and 40 was from COVID, not from any other illness. I mean, they do die. But then it's also the sequela of COVID, no? The post-COVID syndrome, the depression, the brain fog, the pain, the headache, the diarrhea, the abdominal pain. I mean, that you continue to have all of those to that sense. I mean, that we have to press that group and tell them you must be vaccinated. It's easy to convince the parents for lower 12 years and older that they can get the younger brother, who's 8, 9 years old, for which a vaccine is not yet approved, sick also. And we see those in children's hospital, 8, 9, 10 years old. It's not their fault, because no vaccine available today. And they pray with their brother and their sister, and they get sick. And that we have to push to that sense. But I'm fully agree with you that we need now, because of the booster, because of the influenza, that we have to give it some time. We need more health personnel and more vaccination places across the city.
All right, so we should work on that, particularly in Inwood and Washington Heights. And Maria, you had a statement you wanted to make, say it for everybody, and then Carolyn, and then I know the doctor has to go. So Maria, go ahead, say what you say, because that was helpful.
Yeah, we're still running the vaccine hotline. And so we are making appointments for folks in Harlem, Washington Heights, and Inwood, and the South Bronx. And it is in partnership with New York Presbyterian. And so now we're sorting out the details so we can make the appointments for the booster shots, and they will be at the Winter Garden. And there's a location on the Upper East Side, I think. But yeah, maybe something up in the Heights would make it easier for people to have access to. And I put the number on the chat, so please have people call and we'll start making those appointments.
Thank you. Carolyn, go ahead, doctor, go ahead.
You know, how is the number? How many are you scheduling daily? More or less the average?
Well, no, I mean, it dipped once, the fever was over and people could get appointments readily, but we've made about 22,000 appointments for folks just from our neighborhoods.
But talking about now, when I think, like you said, I mean, we are not doing that much education any longer. I mean, we have to let people know that you are still open.
Mm-hmm.
And we have to keep it pushing, call this number, We have to be in radio and TV. I mean, the hospital. The people know that you are still on operation.
Yep.
Okay, Carolyn, go ahead. Stern. Carolyn? Maybe she,
Could you clarify this for me, Dr. Lantigua? We've heard that it's 6 months to 8 months before you could get your booster shot, not just solely 6, but 8 months. And then that you should not have the flu shot connected with the booster shot, and you should wait at least 2 to 3 weeks after the booster shot, which is either 6 or 8 months. Could you
Yeah.
clarify that, please,
We're
Doctor?
using the 6 to 8 months because our people are now, but it's going to be, the number is going to be anything after 6 months.
After 6.
After 6, because it's going to be people soon in December. There are 9 months because they got the vaccine in March. I mean, the second dose in March. I mean, but they're now 9 months. I mean, that those people should get it.
I'm sorry, I didn't understand that. If
Okay.
you were vaccinated at the end of February,
Yes.
when would you be vaccinated?
You could be vaccinated from the end of February, from the end of August to any other time going forward.
Okay, 6 months then.
6
Right.
months and going forward, no? And there's no 6 to 8 months. It's 6 months and going forward. There could be
Okay.
9 months, could be 10 months, could be 11 months. On the booster,
Okay.
no? So far, in terms of the 2 of them, no, we are missing both of them together.
Both of them together.
Yes, yes. Two different arms. You get one in one arm, you get the second one in other arms. But we're giving the booster, and we're giving the influenza, and that's the recommendation. The recommendation is that you can get both of them the same day at the same time.
that's good to
Okay.
know. That's very good to know.
Thank
Yeah.
you.
Yes.
Thank you.
And I think a lot of, at least in this, in Manhattan, a lot of the pharmacies are doing that already, but not everyone, so. I don't know that there are any other questions, Jessica. Do you see anything else? I want to thank Dr. Lantigua for a very concise, fabulous overview. And we look forward to continuing to work with you. And it's always a pleasure to see you in the community. Thank you so, so much.
My honor. Nice to
Okay.
see a lot of friends. I mean, I didn't see Simon when he was a teenager. I mean, how old I am. I mean, I remember him running in short in Washington Heights. I mean,
I remember when you had hair on top of your head.
All right.
thank
You
you.
two are
Bye.
right. Thank you. Thank you very much.
Thank
Our
you.
next speaker is Sally Frank. She is Intergovernmental Advisory for the Situation Room at the Department of Education. Sally, very much, we appreciate that you're being here, and I guess an update on what's being done in the schools regarding testing, responding to testing results, and anything else you want to talk to. I know it's a very broad topic, so we really appreciate you being here. Go ahead. Thank you.
Sure. Can you hear me okay?
Yes, very well.
Hi, everyone. I'm Sally Frank. I'm the Deputy Director in the Situation Room. And I'm mostly just here to answer any questions you have about how we're tracking and managing cases in schools right now. As many of you know, we aligned our quarantine processes to the CDC recommendations yesterday, which allows students who are fully masked in classrooms who are exposed to a COVID case but don't have any symptoms to remain in the classroom. I think that's our main update for this week. So if you have questions specifically about testing or anything else, me and my colleague Laura Atlas, who's here, can answer them, but I'll leave it there.
Okay, well, I have one to start with, which is we have a situation where you are in a classroom, you're a student, you are told that there's somebody who has COVID, and so you go get tested. Now, maybe I'm supposed to know this. So you go to City MD and you have to either wait in line or they give you a piece of paper, you write your name down, your phone number, and then they call you, but it could be 5 or 6 hours. In one case, the little girl had to wait in line for 4 or 5 hours with the father. So how is it, I would say, the testing taking place for students? Because I don't know if that's a common, but that happened twice in one family. and they had to take a whole day of work, not get paid, in order to take the child to City MD. So how is the testing working for students when they're told there's been somebody in the classroom who's got COVID?
Yeah, I mean, for students who are considered close contacts who may have been exposed, we suggest that that they get tested 3 to 5 days after their exposure. I'm really sorry to hear that that family had such a frustrating experience. That sounds awful. I know that we have many H&H run test sites all over the city. And our sense is that the wait lines there may be lower than at a place like City MD. So Laura, I don't know if you're on and can speak to that, but I'd love to be able to share the link of all the testing locations. And thank you, Laura. And encourage families to go to those sites instead.
Okay, I mean, stupid people like me went to City MD the other day in order, I think you heard, to get on a stage. And then I lied because it was 5 hours, 6 hours. That's my fault. Right near City Hall, found City MD. I did not like them. 6 hours later, they called me. I'd already been on the stage and gone on to the next event. But, you know, I'm not a kid waiting for that, and I wasn't an emergency. But I do think that, I don't know that this is possible. City MD makes money on this. I got it. But it might be that when there is that kind of situation, the city should mandate that where there is a long wait, that there is information. Because I have to say, stupid people like me or this family didn't know, forget this place, just go somewhere else. I don't know. They don't want to coordinate because they're making money. I don't know how to do it, but I think this testing situation right now needs some help. You're doing great on vaccines. You have anywhere you can get a vaccine, but at least at this moment, the booster might be a different situation. But I find this testing situation to be challenging. But Laura, go ahead. You might want to add to that.
Hey, everyone. A couple of things. One, if you are a close contact of a COVID case, which is not just to say you're in the same classroom, but you have been in close proximity to a COVID case for more than 10 or 15 minutes, you're not wearing a mask, etc. When tracers call, one of the things they offer is the ability to test somebody at home so that you don't even have to leave your house.
Okay.
Additionally, we recently rolled out in August the ability for anybody who is 65 plus and or immunocompromised to also receive at-home testing. So all you have to do is call a phone number. The hotline is open every day, Monday, through Friday, and also the weekends. It's open 9 a.m. to 7 p.m. You simply coordinate with them and they will come to your house. They will give you a PCR test. Additionally, we continue to run mobile sites, both in the van and in the microsite teams. If people have suggestions for where those folks should go, or people who would like to host one of the teams, you can always reach out to me and we can arrange that. What I will say is it's very difficult to do that with a day or two of notice. As much notice as possible is always helpful.
Okay, Tricia, you had a question. I mean, I don't know why it seems difficult. I think maybe because some of the for-profits are.
Yeah, I think there's a couple of things too. Vaccines had the really advantage of coming online when there was a federal administration that really prioritized ensuring there was a public pharmacy option. Testing did not have that level of support from the last administration. And so really all of the testing that we built was we were building it without any of that support. And so I just think that, now the federal government has made a lot more overtures about becoming more interested in testing writ large, specifically in the rapid testing, which also has created a little bit of a constraint on supply. Because, while on the one hand, they're encouraging more purchasing of rapid tests, they did not necessarily encourage production. So we have a little bit of a strain there.
Okay, Tricia, go ahead.
Yeah, I had a question related to testing.
Committee Board 8. Committee Board 8.
I had a question related to testing, but it has to do with teachers. I have a friend who is a single mother who is a teacher, and her son, her toddler caught COVID for the second time, but she was told that she had to still go in to teach in the classroom, even though she was taking care of a child with active COVID symptoms. She told me that there was no actual testing provided to teachers. And so she was going every day out of her own pocket to get tested, but it was not required. That they told her as long as she was asymptomatic, it was fine for her to come back into the classroom. It just seemed like it was like decision after decision seemed to not kind of recognize the danger that she was in or that she was putting her other students in. Can you talk about what type of testing is allowed for or is being provided to the other staff and teachers who are going into the classroom?
Sure, yeah, I can. Trisha, I'd love to talk through that specific example at some point if that's helpful for you. But to the question that you're posing now, so our in-school testing program is offering testing 10% of the student body bi-weekly, and staff are able to get tested as part of that program. So obviously, if in the example you're saying, if the individual wanted to get tested every day, the in-school testing program is not going to meet that need. But bi-weekly, that person can get tested at school.
I guess just my response to that is that if you know that this person is taking care of a loved one who has COVID, if they are together living with that person, wouldn't it seem like the responsible thing to do would be to test that person every day, especially if they're coming into contact with children?
I think in the example that you're talking about, if the individual is testing positive for a second time within 90 days, the assumption is that that person is no longer infectious, and therefore their close contact, the teacher, wouldn't be either. But that's just general, like I don't know the specifics of the example you're talking about. So that's the information that I have that I can share.
Okay.
But I'm happy to talk about the specific example if helpful offline.
Okay. I mean, just Sally and Laura, the problem with what you're stating is like, it's pretty freaking scary not to know, you don't want to infect others. So I just think you need to reconsider this testing. I think we need to make testing much more available for schools for sure, but just for everyone. That answer is hard to swallow. I have to be honest with you. Only because, like I'm told constantly, so-and-so is positive, go get tested, Gail. I mean, it happens to me twice a week now. And I go get tested, right? It's hard to get tested, but I find a way. I just think you need to reconsider that. People need to get tested to feel comfortable. It's hard to be in the classroom all day long thinking, oh my God, am I giving this to somebody else? Et cetera. So I would really look at that again for those who are in the situation that Trisha just mentioned. Oh, okay, Jane, go ahead. Jane Duncan.
Hi, thank you. What's the phone number for the PCR test at home, please?
Yeah, I just dropped it into the chat.
Oh, okay.
929-298-9400.
298-9400. 929-298-9400.
Correct.
Thank you so much. I appreciate it.
All right, and Carl Dawson, go ahead, Carl.
Thank you. Sorry. I have a couple questions. One, I learned that apparently remote assessments and services have been somewhat suspended, and now only children are getting assessments if they're in person. Is that true?
I'm sorry, that's not information I have, but I'm happy to connect you to folks at the Department of Education to help.
Okay. It's just surprising that as a COVID strategy, that is being an action taken. In the document I'm seeing says it's part of the COVID prevention strategies. So I just would definitely ask that to be reviewed because it sounds very surprising. And then my other question is, what about the the Binax tests that are like pretty effective in-home testing where you could have all the teachers do that and it's like $20 at CVS. I mean, Biden said the other day they're trying to get the testing costs down for those at-home tests, or even in the classroom they could do it, or a school nurse could do it. It's 15 minutes with like over 90% accuracy.
Yeah, so we have those in the mobile units. So anyone who wants to go to one of our mobile units to, get a rapid test, they are more than welcome to. They can also get a PCR test there.
But can't they just go to the drugstore and buy their own test
Sure.
and take it in?
Sure, but so as not to put the costs onto
Yeah,
anybody.
okay. Okay.
That's
Thank you.
very helpful. Thank you. I
Thank you.
appreciate it. Are there other questions, Jessica? Can you help me out? I appreciate you guys very much being here. It's not easy. I think you
I just-
still, go ahead.
I'll say a couple of things just on the note
Yes,
of
Laura,
that.
go ahead. Yeah,
Because
Laura, thank you.
I heard talk on the vaccine portion about this, about reopening the armory and whatnot. I just want to say that we also have at-home vaccines now for anybody in New York City who is eligible for a vaccine. This is not for the homebound, it's not for seniors, it is for anybody. You can do it with any of your doses, first dose, second dose, third dose. You can do all of them at home, some of them at home. Any vaccine that you would like, you get to pick and choose. I also dropped the hotline for that. Really easy process to schedule. The team comes. There's a cool video. There was a profile on one of the local news channels about it that I can share if folks are curious about what it looks like. But a clinical team, they come to your house or your apartment, they create sort of a little sterile space and they vaccinate you right there.
That's good. Do they go to workplaces also?
Generally they're going to homes and people's, family. They can do families all together, I should say. And I should also say that folks are still eligible for the $100 incentive if they get their first dose through the at-home program. So not only are they coming to your house and, kind of making your home a little mini vac site, but you are also eligible for the incentive on the first dose.
Okay. And also, like, you think it's like hard to schedule, like a week in scheduling or a
It's
few
pretty
days?
quick at this point.
Okay. All right. Good to know. And that's for the booster or that's for the original?
For anything, any of them.
Any of them. Okay.
We recently started doing boosters, and I also wanted to clarify, sorry, this Pix 11 piece, you can see a gentleman in Queens who signed up for the service, and you can kind of get a sense of what it feels like and looks like. And again, this is open for everybody. I just want to make clear that the boosters we're talking about at this point are for Pfizer specifically.
Yeah, everybody's doing the other one also though, just so you know.
Noted.
Right? I mean, I've been saying this to everybody because I don't want to give any information out, but the Moderna booster is all over the place. I have many friends who've gotten it. So just FYI, I don't know. They're all getting it. So maybe I have friends who are whatever, but they're all getting it. So when I heard the doctor say it's coming, I'm like, it's come and gone. Just nobody.
Well, for
knows
both
that.
mRNA shots, the original, so there's two different things happening here. There are third shots and there are boosters. What's the difference, you say?
Yeah, what's the
A
difference?
third shot is, so for people who are severely immunocompromised, people who, let's say, have had an organ transplant, they were depleting in the protection much more quickly after 2 shots. So the third shot is really what makes them fully vaccinated. They were not getting a booster. They were just not fully vaccinated until they got to the third shot. A booster is saying we recognize that the immunity level has depleted enough that you need a boost.
Okay.
So officially Pfizer is the only one that has an approved booster. Speculation is that by the end of the week, Moderna will probably also have some sort of an approved booster, although the FDA hasn't officially weighed in yet. Also, I know there is a lot of confusion about this. For 5 to 11-year-olds, Pfizer has submitted their data. It has not been approved yet, though.
Okay. Well, I saw some people got in trouble for doing the 5 to 11-year-olds,
Yes.
but the third shot or the booster for Moderna is well into its implementation stage. Just FYI. Okay, are there any, you guys are really joining us very often and we much appreciate it. I can tell you, I just think one takeaway is, from my perspective, are the schools still need a lot of support for quick testing, and teachers, maybe all the teachers should know that somebody could come to their home, but then they have to come when they're not in school. But I do think that Trisha's example needs to be reviewed, because I can't believe there aren't others in that same situation, particularly when you have the elementary school kids who are not vaccinated. You gotta, the schools, I think the schools need more help than anybody could possibly imagine getting through this year. But that's, Okay, anything else, Jessica?
Yes, we have Dr. Levy from,
No, but I want to thank Laura Atlas and certainly Sally Frank very much for being with us. Thank you both. And you're always with us and we appreciate it very much.
Did they answer the questions from the chat, please?
Sure. Let's see if anybody has them. Go ahead and you can just call out your question. Why don't you go ahead and do that? Does somebody have one?
Millie, I wrote one. What are the hours of the Situation Room? Do you really close at 3:30 p.m. during this COVID crisis in New York City public schools? And how can schools report positive cases after you're closed? Well,
So yeah, during
Sally?
the week, during the week, the Situation Room is accepting new cases from 7 a.m. to 3:30 p.m. New cases outside of those hours, cases can be sent to us via email. It's that I think we receive a tremendous amount of email, so I think that's pretty well known. But and then on Sundays we take new cases from 11 to 3:30. But I will preface that with saying that we complete every case that we receive as long as we have results. That we try to do it that day, and the vast majority are done that day. So it's not like everyone is getting up and walking out at 3:30. We are often there very, very late into the night. We just don't take new cases after 3:30.
Or you take the emails after 3:30, or you read the emails or something?
We review the emails the following morning at 7 a.m.
Okay. I think that's it. All right, both, thank you very, very much. We really appreciate it. And our next, Dr. Ellen Levy, Medical Director of Emergency Services, Lenox Health, Greenwich Village, Northwell Health. Dr. Levy, thank you. You should know that I think everyone knows when St. Vincent's disappeared and was torn down, everybody was very upset. And, you know, and then of course along came Lenox Health, Greenwich Village, and people love your facility more than they loved. I don't want to say they loved it more than St. Vincent's, but it might be true. So congratulations on making it such a welcome health center. Thank you very much. I wouldn't say that, probably shouldn't say that, but I can tell you everybody loves it. That I do know.
Great, thank you so much for the introduction. Just want to check that my video and audio are okay. Can you hear me and see me?
Absolutely.
Great. Thank you so much for having me, and I'll just introduce myself. My name is Lonnie Levy. I'm an emergency room doctor, and I'm the chairperson of the Department of Emergency Medicine at the aforementioned Lenox Health Greenwich Village on 7th Avenue between 12th and 13th Street. So I have the privilege of talking last, so it sounds like a lot of the great content was already put out to the group, and I can't seem to thank Dr. Lantigua enough. He is a really well-versed, knowledgeable physician in the space, and I kind of don't have much to add from what he had mentioned to the group. Being an ER doctor, I have a very different lens that I've seen the pandemic through and continue to see the pandemic through. And what I think I could offer to the group is, I know I want to be respectful of everyone's time. We have 10 minutes left, is just to open it up to the persons that are remaining on the call, if they have any questions about what to do if you get sick. Being an ER doctor, I've seen breakthrough cases, unvaccinated cases. We've also been one of the first emergency departments in our system to give monoclonal antibodies in the emergency department, which was a novel approach to treating COVID early on in the pandemic, and we continue to do so. We've given over 50 to date. And again, we're just one of many emergency rooms in the Northwell Health system. So I can definitely open it up to questions, and I hope I can be a resource to the people on the call.
I think you've already been a resources, but I think, are there some ER situations that you are seeing that you think you should share about ways that would be helpful to you in terms of support that you think we in the community should be offering? Or again, we haven't heard at all, to be honest with you, from the ER perspective. So that would be helpful, because I know, we can always argue too many people use the ER because they don't have a primary doctor, or because whatever reason, the hours. But maybe there are things that you see in the ER that Dr. Lantigua or others might not have thought of. So why don't you talk a little bit about that? Because like I said, you have the premier health facility. If I hear one more person praise you, it's like all they do is talk about it. So congratulations on that one. But go ahead.
Well, it really comes down to our people. The facility can be new and nice with equipment that works and a well-functioning space, but it really comes down to the people. And I'm fortunate to work with incredible nurses and technicians and doctors and physician assistants that really make that place operate to the best of its ability. So, I guess I can give you my elevator pitch is that everyone has their own perception of what an emergency is. And it's really hard for me to sit here and say what you're experiencing is not an emergency. We've since March last year, we've seen our emergency room go from seeing no COVID cases to only COVID cases to essentially no patients to now here we are in the beginning of the fall of 2021, and we're basically at our pre-pandemic volume. We're seeing fewer COVID cases, which is great. So if you look at the positivity rate, how many patients test positive versus the total number of patients that are tested in our ER and across all of our 19 ERs, we're at about 4.5%, which is really, really good. So as a frame of reference, at the height of the pandemic, we were close to 50%. Now you do have to take that with a grain of salt because there were much few tests to go around. But that certainly means that the cases that we're seeing and the patients that are getting admitted to the hospital don't just have COVID. They have things like coronary artery disease and strokes and trauma and acute appendicitis. So the core presentations that we're used to seeing in the emergency room are still coming in. But to tell you the truth, we still have, worried well people that come in and they were concerned about an exposure, or they want to come in and get tested, or they have a breakthrough infection and came in to get monoclonal antibodies. So we're kind of seeing the whole spectrum of what's going on in the community. And I wish I had a crystal ball and I could put my finger on, what the next 3 to 6 months are going to look like. I think the fall is going to be challenging. We heard from people in the education space. We've got flu season coming up, and we essentially missed all of flu season for 2020. Yeah. So what that did was not allow our bodies to build immunity for flu season. So we sort of took the year off. And so people are going to be moving indoors, spending less time outside, potentially in poorly ventilated areas. And so that could be a setup for seeing an increase in flu and potentially another increase in COVID cases. So we definitely have our work cut out. My team, again, I'm very, very proud. We've been doing this for 16 months, not really taking much of a break. And so we're really focusing on wellness and resilience, and our team is able to take meaningful time off to spend time away from the hospital with their families and loved ones and do it safely. And knock on wood, to this day, none of my team members have been infected.
Good for you. It's very impressive. There is a, there is a concern about, I don't know that you see this, any pediatric COVID cases. Is that something that is in your 4.5%, or obviously it was in the past? I'm wondering if you talked about the schools, we're all very concerned about that. I didn't know if that's something that you're seeing or not.
So not really. We're not, we don't see a lot of pediatric volume on a good year. We see around 40,000 visits a year on a good year, maybe 1.5% are pediatrics, and that's including that's 18 and below. Okay. But what we have been seeing is a lot of common colds. So we have the ability to test not only for COVID, but for things like rhinovirus and adenovirus, other causes of the common cold, and we're seeing an uptick in that. And again, it's a lot of the change in behaviors where people are feeling more comfortable, they're spending more time outside, potentially not wearing masks, which you can expect at this time in the pandemic, especially with vaccination rates being so high in certain neighborhoods. But we're not one of those sites that takes, we're not a tertiary care center for pediatrics. So unfortunately, I don't have a lot of information on how it's impacting the pediatric population. But on the whole, kids tend to do a lot better and to be less impacted than adults.
I think something you said was really important, and others maybe picked it up, which is that since last year, nobody I know and got the flu because we were all wearing the mask. So therefore, we didn't build up the immunity. So this year, we're likely to get it from what you just said. That is a piece of, I could be missing, but I haven't heard either the mayor or the health commissioner even say that. And that would be very helpful. I must admit, I would just say to everybody, wear your damn mask, because you're not going to get the flu, you're not going to get COVID, of course, get vaccinated. But the mask has been a huge asset. And of course, in the Asian community, where they've been wearing masks for years, very few people, it's 100% vaccination and nobody gets the flu. So, the rest of us should wake up. But that's an interesting point about getting the flu shot, because you're opportunity for getting the flu is very high. You're something to mention over and over. Common colds. Okay, Jessica, go ahead, Doctor.
Yeah, just one quick comment on that. Diagnostically, it's very challenging to tell the difference between flu and COVID. They present very, very similarly. So you had mentioned testing being, a potential issue right now and a constraint. So, fast forward a few months when there's, cases of not only the common cold, but flu and maybe breakthrough cases of COVID, it's diagnostically very tough for clinicians to ascertain what's going on. So we do have the testing capacity to do it. And there are certain tests that can let you know if you have flu or COVID plus any other of the 16 common respiratory pathogens. But I think for the community, it's really having a plan, right? So kind of rehearsing this in your mind that like, hey, if I get sick or if a family member gets sick, where am I going to get tested? Who do I call? I think waiting to that moment when you're sick or not feeling well, I think can just muddy the water and make the level of anxiety rise.
Excellent. Val, you had a question? Go ahead. Community board number 3. Go ahead, Val.
Yes, my question is, how do you help people to feel more comfortable about coming into the hospital for their various physical issues? Because I keep hearing of people that are getting sick with things that's not COVID. And when they get sick, when I hear about it, it is like they are very sick. It sounds like they had it for a while and were uncomfortable thinking about going to the hospital, to the emergency room, et cetera. So what do you say to people to help them be more comfortable with coming for what pre-COVID they would have went to a doctor for?
Ms. Jones, that's a great question. So it's a tough question at the same time. So waiting to the last minute to go and get evaluated for something that could be potentially harmful is never a good idea. So, our mantra in our emergency room, and I can't say that it's the same mantra in every emergency room, is that whenever you come in for whatever complaint or reason is your own emergency. And actually, the hospital is a relatively safe place. There's not been a single case in our facility of community spread of COVID. So in the beginning, when there was not a lot of information out there about how this was spread and what are the mitigation strategies, we've taken every single step, whether it's PPE, it's having dividers in break rooms and having seating 6 feet apart. So when our staff eats, they're not infecting other staff members. For our own emergency department, we have 26 private rooms that we can shut the door, and that's essentially an isolated room, and 5 negative pressure rooms. So, putting on my patient hat, if my wife, or I don't know if you heard one of my screaming babies in the background, were sick, we would want to know that if we went to a hospital, an emergency room, an urgent care, that our complaints would be taken seriously. And I think in this landscape, you have to. I think you have to be more humanistic about what's going on. It's not just the physical, it's the mental health component too. So I think my hope is, and again, this is something that I think my team does very well, is that it's a holistic approach. It's not just what's going on now or what was happening 6 weeks ago. It's what's been going on for the past 18 months.
Val, I think the answer to your question is tell everybody to go to Lennox Health Greenwich Village. That's what
I was thinking that.
I'm telling you, you have, Dr. Levy, you should hear them talk about this. I mean, I'm talking to people from Washington Heights. I hate to tell you, they come to your facility. Don't tell anybody in Washington Heights that I said this, because they love it so much. So really, it's a congratulations, I know, to the whole team, but you have a lot to do with it. So I just want to let you know it's out there in great accolades.
I appreciate it.
Definitely. Please pass it on to your staff to thank them. Jessica, do you have anything else? Dr. Levy has been very upbeat and very informative, and it's much appreciated for all of us who are, I think that 2 things that I came away with, obviously have a plan, and secondly, deal with the flu. Because I must admit, I'm one of these people over the years, I've never gotten it. So I thought, I'm not going to be stupid this year. I'm going to get the flu shot. Just like, and Dr. Lantigua said, I can get the flu shot and whatever else is, I'm not going to tell you, available in my neighborhood, because it's kind of under the radar. So don't tell anybody. Jessica, anything else?
Nope, I don't see any other questions. If anyone wants to jump in.
Okay. I think we'll say, Dr. Levy, thank you so much. It's wonderful to meet you, knowing I have to tell you, I go by your facility and I start smiling. That's how great it is to the whole community. Thank you, and thank you, everyone. We'll see you next Tuesday at 3 o'clock. And I hope this has been helpful to you. It's certainly been helpful to me. And I thank all of our speakers. Thank you, everyone from the Department of Health and Test and Tracing too. And the Situation Room. Thank you very much. See you next week.
Thanks.